Professor Juan. The first part of the morning is going to focus on brain health, the burden of brain disorders, and the way towards better brain health globally. Our first keynote speaker, we're so glad the plane arrived on time, is on global brain health, and it's going to be given by Tarun Dua, Head of Brain Unit, the Brain Health Unit, the Department of Mental Health and Substance Use at the World Health Organization.
Hi, good morning, everybody. And so let me see if I can get this going. Right, brilliant. So my pleasure to be here, and thanks to the organizers for having World Health Organization give this keynote speech on global brain health. And what I'm going to focus is, as we think about brain health, there are many concepts, many issues, and I'm going to focus from the angle of public health, because as the WHO, as the health technical agency on health, I think that's very important, that as we think about all the basic science research, as we think about new treatments, how are we going to get it to patients across all parts of the world? And I think that's where the importance of public health comes in. Now, this will be preaching to converted, but much of it is that how our understanding of brain has evolved over time, but still we don't know much. It's scratching the surface, as we think about it, starting from 335 BC on what the Greek philosopher Aristotle thought about it, how Leonardo da Vinci drew it. I used a Belgian anatomist example just because we are here in Brussels, no specific reason, but just to say that quite a bit, there has been a lot that's going on in this space, but it's like the tip of the iceberg, that there is much that we need to do, because as we know, it's important if we take care of brain health, and you will hear more about it, how this is important for all the various physical and health and social and economic outcomes. And I think this is an important public health message that we need to use as we talk to different policymakers, as we want to take this forward. I thought I'll show the Brain Health Unit, and the reason is that why I'm showing the Brain Health Unit in World Health Organization, because it's a new unit that has been established. While brain health and neurological conditions have been a priority, even in our organization, it has taken many years for such a unit to be established. Elena tells me that there's a nice piece on the unit in Lancet Neurology, so she'll circulate the link to all of you. I haven't yet read it, but I think it will give you a flavor of how do we want to take forward the brain health in terms of promoting optimal brain development, cognitive health and well-being for all, preventing and managing neurological conditions across the life course. When I use this slide, people point to me the lack of gender diversity, but rest assured, I'm working on that. So in terms of where are we, where do we want to move forward? I'm speaking in the global partnerships on brain research, and research is something that is important. But ultimately, I think what we want to take forward is strengthening the policy, service delivery, health system strengthening that is needed, and research, how the evidence from research can help us in doing that. So the research translation. We as WHO don't do research. We rely on you to generate evidence, but then it is for us is that how do we translate that evidence better? And we want to come to you and tell you, okay, these are our priorities from a public health angle, and that's where the focus should be going. What we also want to focus on is enhance the collaboration, and so I'm very glad that we are talking about these global partnerships in brain research, and Europe to take the lead role, the European Brain Council and European Federation of Neurological Societies and IBRO to make this happen. But will be also, when we are thinking about these global partnerships, that we have the organizations across the world, from Africa, from Asia, come together and discuss many of those issues, because ultimately, as we want to see is the patients at the center of that care, the families receiving the care that is needed. So in terms of global mandates, now what are these global mandates for people, those who don't know World Health Organization, is that there is a governing body, which is the World Health Assembly. World Health Assembly has action plans or strategies, and there are 2 action plans that are relevant to neurological conditions. I'm not talking about the mental health conditions. There is a comprehensive mental health action plan that exists. And for neurological conditions, there are 2 of them. One was the dementia, the specific action plan on dementia, which was endorsed in 2017, goes up to 2025. And then there is a new one, which was endorsed last year on epilepsy and other neurological disorders, which has 5 strategic objectives and 10 global targets. You all know about these action plans. But just to say why these are important, because all countries have endorsed, all countries have signed these action plans, and it is for them to take forward how the targets should be achieved. It has actions for WHO, what WHO is doing, but it also has action for partners, both national partners and international partners, including the non-state actors. And I think that's where I encourage you to look at that and to see how we can work together to achieve those global targets. And if you read the action plan, they are very, very, very ambitious. The welcome speech talked about brain health, a compelling reason for global action, and that why neurological disorders are important in terms of disability, in terms of death, in terms of the economic burden. I'm going to talk about the second part of it. We know the burden is high, but are we doing enough? Are people getting the services? Are people getting the support? And if you look at the treatment gap for neurological disorders, for example, the one that we use very often, the example of epilepsy, 75% of people with epilepsy, 3 out of 4 do not receive the treatments in many parts of the world, the low-income countries. So is this acceptable when we know cost-effective treatments, they exist? And this is where knowing the burden is one thing. Yes, we need to know about it. What are we doing to address that burden? And that's where, and this is where I bring again the message of implementation research, that as we have these treatments and strategies, how can they help us in getting the treatments? You all know about the number of neurologists, and we say that there are a lack of neurologists in Europe. Think about many countries in Africa where you will have 1 neurologist for every 3 million population. All the organizations across the world all the universities are never going to have 1 neurologist, let's say, even for 100,000 population. So how are we going to work with the primary healthcare system to train them into providing treatment and care and services? And that's also part of the research that we should be looking at. And this brings me in our thinking of taking that integrated approach to neurological disorders. So I know that we have our favorite conditions. You know, we talk about epilepsy, we talk about dementia, we talk about Parkinson's disease. But when we think about health system, there's only one health system. There's going to be only one doctor, one nurse, maybe. And so how do we bring it together? When we talk about these neurological conditions, there's a continuum of pathway, and we need to keep the aspects of the rehabilitation, the aspects of all aspects of health and social care together. We need to take that life course approach, not to forget the children, not to forget the older adults. And how do we take the various opportunities that exist in countries? For example, the universal health coverage. Is it part of the UHC benefit packages in countries? And that's one of the targets of the action plan. And so this is an example of some of our thinking about brain health across the life course. Within our unit, we work on issues related to neurodevelopment in children, issues related to older adults, for example, in dementia. But as I said, we are a very small unit, and this is where the global partnerships across all aspects are extremely important. Now, we have come a long way in our understanding of the brain, but more is needed. And I have touched on a little bit this earlier. And I just wanted to show this Optimizing Brain Health Across the Life course, the position paper that we published last year. And why we came out with this position paper, because as we was looking through the literature, we have been using the term brain health. There have been many definitions. A narrow understanding of brain health as stroke dementia to everything under the sun can be thought about brain health. And so this is our framework for brain health optimization, and this is something that we thought we need to bring to the world in terms of understanding what actions needs to be taken, understanding how brain health needs to be measured. So how do we look at the outcomes? How do we look at the brain structure and function? And how do we look at the brain health determinants, which are not only in the health sphere, but across like environment, safety, security, learning, social connection, access to services. And because all these will help in finding the policy actions, but also the measurement. Because one thing we do know, if a measurement is extremely important, and I have a couple of slides to go into that. So first aspect of measurement is understanding the burden. This has been raised. We need to know the burden. And I'm not going to talk about it because Theo is going to talk about it in detail when we are working together with IHME and looking at this extended neurology envelope and how this can help us in making that case for action. Right. And then the other aspect that we want to the measurement is that if you don't measure well, things they do not get done. And this is where we are working together with many of you taking forward and looking at how do we measure the brain health determinants, how do we measure the brain structure and function, and how do we measure the outcomes. And we are organizing a small meeting together with IHME, focusing on early years on some of these aspects. And so watch this space in terms of looking at the brain health metrics. That was from the focusing on the early years. I just also wanted to share an example on fueling brain health research from the dementia sphere, where we printed the blueprint for dementia research. Now, why this is important? Because you have heard about blueprints for communicable diseases, infectious diseases, for example, Ebola, Zika. There was one for COVID-19, and this is about creating that coordination, creating that enabling environment so that there is efficiency, equity, and impact. None of such blueprints, they exist for non-communicable diseases. In the welcome address, you mentioned that it's a pandemic, but are we thinking of research in a coordinated way? And this is where we had bringing together many experts to create this blueprint, thinking about different research themes and different drivers, and they are extremely important. The drivers are extremely important, that how do we empower people, how do we ensure diversity and equity in our research, how do we think about the capacity building, how do we think about knowledge sharing. And that's why I mentioned this, is that we should not only think about generating knowledge, but also that sharing and exchange of knowledge and information. That is an important aspect of public health. That's my last slide. And so what next? How are we going to take forward in that integrated intersectoral response is from a policy angle. That is, how is it part of policies, funding, budgeting processes? How is this part of universal health coverage from prevention, treatment, and care so that these can be addressed? One part that is extremely important is engaging people with lived experience, because ultimately it's not the top down, but it's the bottom up that is going to make a change happen. We have seen in other arena, and I'm glad to see that we have patient societies here present today thinking as we think about global partnership in brain research, and it is together that we are able to make the change that is needed. And of course, we talked about the economic case, making that case for investment. That is very important. That works in politics, right? You need anything that, with all the banking collapses that we are seeing and hearing this week, that making that case for investment is extremely important. And last, I talked about engaging people with lived experiences, but also it is very important that we empower them. any brain research that we are involving them, we should also not forget that it is their empowerment that is extremely important. So with some of these thoughts, key messages, I wish you a very good meeting. So thanks for having WHO on this. Thank you.